Oh Lord, I just realized that my eyelash glue is still on. Alright, that's how today's gonna go. So I figured to give you guys a little bit of a health update. And you ever wake up and the days are like, fuck my life. This is how today's gonna go. Alright, cool. You're awesome. Ugh. I'm gonna mute the TV, guys. So I normally make short videos for anybody who's new to shorts. If you're subscribed to me, it'll just pop up on your shorts. Shorts, literally on your main YouTube page, it'll say shorts with the little videos that go across. Yeah, click on that. You'll get a bunch of them. It's easier to watch 60-second videos than my nonstop talking for half an hour. So I figured to let you guys know how my health is going. The reason why I'm making this video is because I preach, be your best own advocate. Be it. Goddamn, Heather, your hair. Sorry, God, for using your name in vain, but have you seen this, bro? Oh, I'm going bald, too. That's another thing we need to chat about. I have a lot of doctors. They are not on the same wavelength. Some of them are assholes. And when you live in a small town, you don't get many options. I'm also legally blind, so I get Medicaid to get me rides to my doctors. And they are I almost died last year because they were same doctor, same autoimmune doctor I've been seeing for like 7 years, 8 years. I don't know. I feel like once you hit like the 5-year mark, you don't even remember shit anymore. But they were like, oh, we need a note to say that he was your doctor. Boom, did it. Oh, that's not good enough. You guys just told me what to do, and I did it. And they did it. So what's the problem? It was a back and forth fight for... I'm like, listen, if I die, it's on you, boo-boo. Not me. Not them. Not anybody else. You are at fault. This email is now saved. And fuck you. Within an hour, they approved me. Probably because stop doing this back and forth shit, Medicaid. We're all sick of it. If we have health issues, you think we want to deal with your drama? No, boo-boo. We do not. No. Thanks. Also woke up to my hands swollen as shit. It's funny, my son's autoimmune doctor who left. Dr. Lopez, we miss you. I don't want to have to freaking take a plane with the crazies to go see you. I don't know how we're going to do that. Because the doctor office now is... The medical field needs to get better. Be better. Like, why are you such assholes? And I'm not saying all of you, but like 85% of you. There's some of them that are diehard help. They truly care about the patients. And I mean like the whole medical field. It could be people who talk to people the most and make appointments. You got some of the nurses. Some of the nurses are just mean. I'm just like, girl, do you think I know I don't go through enough? That today's the day during pulmonary embolisms or whatever, I had to put up with your shit? No, thanks. I'm good. Keep that shit for your mama. I don't want to hear about it. So, when I went to my hematologist, my vitamin deficiencies have been off the fucking chain. And not in a good way. They're literally dangling for dear life. Due to autoimmune, I have like 20 deficiencies. And it's not from eating, because I make sure I eat those things. But I have malabsorption. Malabsorption is your body's a duty head, and it won't absorb this shit. So, for people who get vitamin deficiency, like, when you're really, really dumb low on the vitamin deficiency, goddamn, what? Sorry, I'll get better with stop saying that. My eyes are glossy as hell, and I don't know why. Heather, stop using the Lord's name in vain. Your grandmother in heaven's yelling at you right now. I've been getting a lot better with that, surprisingly. This is the first time I used that in like 5 months. So you know I'm pretty upset if I'm using it. But I'm going to stop because it's annoying. I annoy myself. But I was talking to my hematologist and I was like, listen, dude, I got the worst brain fog. I can't remember a word. If you guys don't see me posting a short or normal video in like a week, you know something's going medically wrong with me. Because I'm a chit-chat person. I like to talk. I feel like I'm talking to myself half the time, guys. I'm not even kidding you. But honestly, if you guys do not have a YouTube channel, I recommend it. Be by yourself and just make a video of yourself. Do video diaries. Because it's so surprising what comes out your mouth. And it's so surprising that, like, you're like, I don't know what's wrong with you. All of a sudden you'll talk. And then you'll be like, all right, that's what's wrong with me. You know, I'm having issues with this or my anxiety. Like, you'll get that video. I recommend it to all. So you don't have to post it. It's just for you. Talking to you guys helps a lot. Even though some of you probably make fun of me, but that's okay. I'm 37 and don't give a crap. Man, there's so many things I want to tell you guys. It's insane. But anyway, the deficiency, it's like I couldn't hold a word or thought. Just doing it. And like the insomnia has been off the hook, bro. I'm up every 2 hours. My leg pain is really, really, really bad. For people who have like vein issues, blood clots, shit like that, and now supposedly I don't have any right now. They also haven't checked recently. My legs hurt. If I had a choice to be like, Heather, do you want to chop off your legs today? I'd be like, where do I sign? And then my one friend's like, what about phantom pain, Heather? And I'm like, shit. It's never gonna go. I can have no leg and I'll still have leg pain. That's madness. That's freaking madness. I need a vacation. Anyway, I asked him, I'm like, who's supposed to handle my vitamin deficiencies? He goes, your primary. And I asked the nurses. They all said the same thing. I'm like, Mallory, girl, you're dropping the ball like... Even when I saw her for the year of my blood clot, she was like, oh, you're fine. I don't see any swelling. I'm like, my arch is swollen, boo-boo. Like, I needed a cane to walk. I actually fell into traffic, and the guy screeched his car and saved my life. Thanks, dog. Don't know your name, but I appreciate you letting me live a little longer. That girl, my primary is a dumb chick. And people are like, Heather, get a new one. I live in Smallville, USA. Where would you like me to pull one out of my ass? All of them are so ignorant. All of them have never seen experiences of people like me. And any doctor will tell you that knows me, my case is beyond rare. They have never, even my doctor, who's completely seasoned, my rheumatologist, who works with the Scleroderma Foundation, has never seen a case like mine. And he wants to retire, and I was like, please don't. If you leave, I die. So, no. Love you and all, but please don't. He's like, I wouldn't leave you guys like that. He's like, I'm definitely training people. He has a scleroderma clinic in Albany Med. Well, with Albany Med, but it's in a different town. And Malta, I think it is. For anybody who lives by me, you know where I go for autoimmune. In the middle of fucking nowhere. His neighbor is a cow. I'm like, dog. All right. Cool. And he moves a lot. I'm like, dude, stop moving. Even the people who go with him, like his secretaries and nurses, they're like, bro, you need to stop traveling. Pick a spot. Stay there. Just stop moving. So anyway, I love Dr. Shapiro. And I spoke to him. He knew what I was going through. He's like, it's B12. I'm like, I know that. You know that. But Mallory's ignoring me, dog. And he was like, Heather, what do you always tell people? I'm like, be your best own advocate. He goes, do it. He goes, if she gives you any more shit, I'll step in. But he's like, I need you to do it on your own and not be afraid of any repercussions. It's your healthcare. He's like, it's your body. It's your everything. Fight for that shit. Just like you always tell people. I'm like, let's do this. So after years of my primary keep trying to kill me, and I'm not even lying to you, like, I don't know if she's just very uneducated. What's crazy is I had her since she got out of med school, which I'm not happy about. She also told me I had IBS, my gallbladder exploded. Yeah, that was her. Damn, what is she needs to get better. In the middle, see, I've been seeing her for 7 years. So, like, in the middle of all that, or I think it might have been even longer, 9 years. I don't know, whatever, to each their own. But in the middle, she was doing very well. She was, like, working hard on researching. She was one of the people that didn't believe me I was going through shit before I was diagnosed with autoimmune. And she would treat me like I'm some druggie. Honey, boo-boo. If I was going to do drugs, you'd think I'd ask you for it. Let's just be real. All right, let's move on. And that day, I actually lost my shit on her. I was like, test me right now. Give me the urine sample thing. Go take my blood. Let's do this. Let me prove you wrong so you shut the fuck up. And she just stopped. And I'm like, I'm tired of being judged. Because I go through shit. All of a sudden, my pain. No, give me the fucking cup. Let's do this. They did it immediately. Results came back completely fucking negative. And I looked at her. I'm like, you think I'm dumb enough I'm a girl from the hood, man. You think I'm dumb enough to ask you for drugs if I wanted to be a drug addict? Does it say stupid across my forehead? Move along. So doctors have always, I've had many doctors stand up for me to her. Because they gave me a small dose of pain med, just take the edge off it. Because when they did the EMG, they're like, girl, you're in too much pain. There's a test where they can determine the ish amount of pain level. It was off the fucking chart. And then they started doing MRIs through the whole body. Lesions from head to toe, man. I have no cartilage in my knees and most of my joints. My Achilles heel is ruptured and they didn't do shit about it. Like, it's been a mess. You just glue me and duct tape me, and that's about how their medical care goes. So I've had doctors literally tell her, which I saved, and I printed it out in the email. They CC'd me and they said, it was Dr. Cummings. He was like, listen, it's your job for primary care. Heather is going through a tremendous amount of shit. He's like, I'm a well-educated doctor, and I've done many tests on her, and she is struggling. If I'm telling you to do something, you do it. If you cannot do your fucking job, then go find a new profession. Because I'm tired of you treating her badly. And I'm like, I thought. Dr. Cummings was my neurologist until I got too many diseases, and he was like, yo, girl, can't do this. But I respect that. I respect that when a doctor's like, your case is a little difficult, sister. So I can't treat you. He's afraid he's going to kill me. I get it. I'm afraid they're going to kill me too. We're in the same boat. That's how I ended up with dentures, is because Dr. Shapiro put me on Cellcept, which is supposed to be great for scleroderma, but they didn't know all my autoimmune diseases yet. Gave it to me, caused massive infection. Normally when your body reacts that quickly, like before the 6-month mark, your body reacts that badly, that quickly, that means you have another autoimmune disease who's super pissed right now. And that's when I had to get dentures. And they were like, we got to figure it out. But I wrote to Mallory recently about this whole vitamin deficiency shit. Sorry guys, I'm all over the place. It's morning. I haven't taken all my meds yet. I'm timed. I'm a very structured person. I take everything at the same time every day, and I mix them up so I don't burn a hole in my stomach. So, my bad. But I was like, you're supposed to have all my vitamin deficiencies on file to where if I need to get blood work done, I can get it done every month, every 3 months, whatever deficiency it is. I'm like, you don't have any of it in there. You haven't even checked my B12. I'm like, since May, and even then it was low. And I do my own B12 shots, guys. Yes, I do my own, because that's how often I freaking eat it. And I don't do like 100 mcg, it's 1,000, because my body doesn't hold it. The problem is Dexalon, my PPI medication that I need for my esophagus, because I'll die without it. Within less than a month, I would die. Sucks the B12 soul out of you, along with scleroderma. Everything is out to get me. But I'm a crazy woman. I got this. Sometimes I lose my shit. Like when I broke down over 46 pulmonary embolisms. But I feel like that's fair. Who the hell wouldn't be like, how the fuck did I ended up with that many? It's probably like Guinness World Record in one shot of pulmonary embolisms. And I've died almost like a lot of times and came back. I shit you not. And I feel like everything is just crashing down on me at that moment, which is why I lost and I started crying. I normally don't cry. I cry only when, like, my PTSD kicks my butt. We'll just say that. But I told her, I'm like, you're supposed to have this on file so we can stay on top of this. This is the point of this. We're supposed to check some of my vitamin deficiencies every 3 months. My really ones that I lose a lot, which would be ferritin, which is iron. My ferritin and B12 should be done monthly because that's how bad they are. And I've been B12 deficient. We'll just say probably Thomas's age length. I'm like, listen, Mallory, this is how it's gonna go. I'm tired of you almost killing me. I'm tired of you not being educated, and then you look at me like it's my fault. I'm like, you don't do the research. You know how complicated my case is. You know all of this. I'm like, and you still do nothing to help me besides aggravate me and make me want to lose my shit. Disclaimer, I'll be talking about some mental health stuff, so if you guys can't listen to that, get the frick off. Now. Okay. So I'm on PTSD meds. One time for my husband almost killing himself and me saving his life a couple of years ago, which put me in a flare-up. And hi, pulmonary embolisms. There you are. For anybody who's a member of my page, like an actual membership, a couple $2 a month to support my video situation, it's all on there, the story. I'm not going to go into it here. And, you know, PTSD from pulmonary embolisms, I was pretty suicidal this summer. You know why? Because she was like, Heather, you need to lose weight. I'm going to take you off your PTSD meds. I was a ball of mess. Don't cry, Heather. It's so vivid. I was such a mess with so much intrusive, scary thoughts in my head and reliving all the bad stuff. Holy fuck, why are you crying, girl? I wrote to Mallory when I was going through that, because they always tell you to reach out to somebody. She's the one that did it, so she would be fixing it. I never heard from her. A nurse read my thing, and Mallory wasn't there. And she called me. Tracy, thank you. You saved my life. She was like, take the med now. I'm like, I don't take it until nighttime. She's like, take it now. She's like, you should have never been off of it. She's like, Heather, don't ever think you're weak. You've been through more than I've ever seen any human being go through in just a matter of 2 years. She's like, you're a strong, badass woman. Don't think less of yourself. She's like, you should have never been forced to be off of it. Mallory never messaged me even till this day, which was months ago, to even check on me to see how I'm doing or apologize. Nothing. That's how fucked up she is. And I figured since she's been my doctor for years and we've seen and gone through some shit together, that she would have cared a little bit more. So that alone, she's dead to me. That's how I look at it. Like, I don't care about her feelings anymore. I don't care about shit. I'm done. So I spoke to my therapist like a couple days later for a normal routine. Hey, Heather, how you doing? Kind of thing. And I told him what happened. He goes, wait a minute. You're talking about Ativan? I'm like, no, I used that as a rescue. I took myself off of that. And he was like, you took yourself off of that? I'm like, yeah, I only needed it for pulmonary embolisms. Just almost died without it. So I figured go back to rescue med with it. And he goes, damn, you're smart. And I was like, well, it's not going to work if I need it. So and he goes, but are you talking about your PTSD med? Remeron? And I was like, I call it Remeron because that's literally how it's spelled. And I was like, yeah. And he was like, well, why did she take you off of that? He was like, I don't understand. He's like, after what you went through with your husband, and after what you just went through with pulmonary embolisms, which is one of the most scariest things a human being can get medically, why did she take you off of it? I'm like, she wanted me to lose weight. And he goes, I'd rather you be mentally good and chubby than skinny and suicidal. He goes, what the hell is wrong with people? He's like, go back on it. She will never bother you again. She will never tell you to you stay on it as long as you need to, Heather. And that's why I say I have some great doctors and some of them that are just like, it bothers me tremendously that I feel like my primary doesn't give a shit about me. So when I wrote her that note and I was like, listen, you've almost killed me. You destroyed my mental health. You destroyed my physical health. You treat me like everything I say, I'm lying to you. I'm like, I've never lied to you a day in my life. I'm always honest with doctors because it can save your life. I'm like, for you to be this disrespectful to me, this rude, this crude, have no care in the fucking world what happens to me, and not even one apology that comes out your mouth after you almost killed me too many times. I'm like, I'm done. I'm done. So we're going to do this my way. I'm going to be doing B12 once a week for the next month to get my B12 back up there. Then I'll be doing it every 2 weeks. You can either hop on board and be part of my care team, or you can step the fuck off. I'm like, because I'm done now. I'm done with letting you freaking browbeat me and treat me badly. I'm done. All because I don't want more stress to piss off my inflammation and everything else. It's not doing it anymore. And then she's like, then trying to be nice. I'm like, I don't need your pity party. I don't need your niceness. I need a fucking doctor. I'm like, but you're not a doctor. You're just a PA. I'm like, a PA is a physician assistant. Even a nurse practitioner can go off and have their own business and have their own everything. They don't need a doctor to fall back on or be behind. But physician assistants do. I used to have an ounce of respect for her in the middle of the 7 years, probably like 4 years ago. I have no respect for her now. A lot of people are like, Heather, why don't you just sue after what she's put you through? And now I have permanent damage. And I'm like, well, got to get all my information first, right? And I know the medical facility would make my life a living fucking hell. But I'm not going to let her destroy me anymore. After the pulmonary embolism thing, she was already on like a thread of my patients. Once she was not helping me, talking to me like I'm a child, and they, what's the word I'm looking for? She literally gaslights me. Everything is a mental issue. Because when I was going through the clot thing and all of that stuff, she'd be like, you sure it's not your ADHD or your anxiety? Bitch, I'm not dumb. I know the difference. I'm 37 years old. Granted, I look way younger than 37, but I'm 37. I'm like, stop insulting me. Stop saying, oh, it's mental health, this, mental. You almost killed me with that mindset, chick. I'm not the problem. You are. Like, I'm not a Taylor Swift fan, but she needs to sing the song, I'm the problem, it's me. Because she's the fucking problem. So I'm going to tell you guys something. Be your best own advocate. You know, you don't have to yell, scream, rant, and rave. Because nobody respects when people act like that. I mean, I get when people just haven't had enough, but I've seen people just act like that over everything. If you want to be heard, be respectful, be stern, don't give in. It's your body, your mind, your health, your life. Do not give in. Oh, and by the way, not only is my B12 trashed like I said it was, but my folate is too high from them giving me too much folate when I only had no folate because I had pulmonary embolisms, because that's what happens. Well, they gave me a high dosage of folate, which was 1 milligram, and my folate was so high, it was undetectable, the exact number. So like I say, be your best own advocate. Don't wait to die. Don't wait to be hospitalized. Stand up for yourself. It doesn't matter. That's why I tell people all the time. I get people are intimidated by, I think every person in this world gets nervous, scared, and everything with dentists. But you got to understand something. If you're scared of a dentist and you won't go to a dentist, you're still going to end up going to them regardless and be forced to when your teeth need to come out from the massive infections. So it's better to protect and save your teeth than it is to still end up going to the dentist because your teeth are rotted out of your mouth. It's kind of true. So I always tell people, if you have severe anxiety of a dentist, ask for Ativan, something like that, for your primary doctor, just for that visit, and do whatever. And also speak to a therapist. There is nothing wrong at all with seeing a therapist. I mean, sometimes it could take time to find the right one. Dr. Anderson, who's the head of therapy, wasn't originally, but he's been my doctor, my therapist for like 10 years. And he's like mad chill. He's like hanging out with a homie. And he was like, Heather, stop being hard on yourself. He tells me that all the time. Stop being hard on yourself. You've gone through way too much. You're way strong. He was like, stop being upset with yourself if you haven't mentally progressed more. He goes, you've been through a lot of trauma. And he goes, that's just in the last couple of years, not your entire life. He goes, stop being hard on yourself. He's like, you're strong. You do everything yourself. You work hard. You don't give in to anything. He goes, give yourself a mental break. I'm like, I'm already in a breakdown, but cool. But be your best own advocate. If you guys need to talk to me about dentist medical stuff, what medications could be best for this thing that you have. Like, I know a lot about medications, more than I probably should. If you need help knowing what doctor to see, what tests to be done. For doctors, dentists, doesn't matter. I am always happy to help any single one of you. My email is always in the description below. Which again, the arrow next to the television video. I love when people say they watch my videos and they'll ask me the questions I already answered in the video. Happens all the time. I'm like, did you watch the video? Because it's in there. Like, if you don't want to listen to this 24-minute video, when you click on the video, but then you click like a setting part, you can actually speed me up, and it'll be like 10 minutes. So, but definitely watch the videos fully through, guys, if you can, because a lot of the questions you ask me are in the videos. Any topics you guys want me to talk about? Medical, not medical, parenting. Remember, I did that alone with 2 kids. Shit's rough. I gotta say, they're harder now as teenagers than any age group. But I'm always happy to help. My email's everywhere. The arrow next to this video, click it, boom, email's right there. And that's how you get to any YouTuber's bio. So, get a hold of me. I can always help. I'd rather help people and give them the information, whatever they're looking for. Even if I don't know, I've researched this shit out of everything. I've been on here for 4 years. Anybody who's continuously watched me can tell you I over-research. Because I don't get it from people's opinions. I want facts. I want actual facts. And then opinions. But I love you guys. Thank you for listening to my hot mess of the day. Appreciate you. Thank you guys for watching me, truly. And for a lot of you that watch me faithfully, thank you. Because you guys are the reasons I do this. I wouldn't continue making videos unless people actually watch them. Granted, I don't get a lot of people watching my videos, but for anybody to do YouTube, it's got to be worth it, you know? I mean, it's kind of barely worth it. I don't make anything off of it. Kind of wish I did. But definitely get a hold of me, guys. And watch the videos. Like, subscribe. I'm now hiding my giveaways again. I have a video going away right now. Right now, yesterday's video is a giveaway, so if you guys want to get in on that, do it. It ends Saturday at 11:59 p.m. Eastern Time, and I'll pick somebody out. And remember, if I do pick you, make sure you answer me back within less than 24 hours, because then I pick somebody else. Because the giveaway can't go on forever, which is why I have that kind of thing. But I hope you guys have a great day. And just realize, people can look like they have everything together, or they can, you know, like I always say, the grass isn't always greener on the other side. That saying has been around for forever. And it's true, though. Everybody has good and bad times. Everybody struggles. Everybody goes through shit. But you don't have to go through it alone. I love you guys. Have a great day. Later.